Some important questions, like Viva questions, which can be asked in the, uh, you know, in your practicals. So, like whatever the topic is and subtopic, like classifications, it can be asked again. Mechanism of action of any prototype drug, right? Like uses, side effects, contraindications. Side effects and contraindications should be very specific, not nausea, vomiting, diarrhea, okay, and not NVD. It will be very specific to a particular drug. Now common drugs, okay, common drugs will be asked. Now what are the special points about any drug or any classification or any group of drugs? That's important. So what's the first class of drug? So let's discuss one by one. Antipsychotic and antidepressant, okay. So antipsychotics and antidepressants. So again, the classification, the mechanism of action of typical and atypical antipsychotic as well as antidepressant, okay. So we should know that MAO A is associated with antipsychotic, right, and MAO B is for the anti-Parkinsonism. So where it is present, what is MAO, what is MAO B, okay. Now the drug olanzapine as such is very important, is commonly very used, right. Now difference between amisulpride and levosulpride, this is also very important. So we should know one is atypical, one is typical, okay. So what's the difference between amisulpride and levosulpride? Other question can be asked is anti-Parkinson and anti-Alzheimer's. So what's the, like it will be asked like, what do you mean by Parkinsonism? What do you mean by Parkinson disease? Okay, first difference, what is drug induced Parkinson? Okay, what are extrapyramidal side effect of antipsychotics? Okay, now where is the levodopa used in drug induced Parkinson? No, not used, okay. So this kind of question can become in dementia. This is the most common cause of dementia. So these two class of drugs are important, okay. Maybe anti-Alzheimer's or it may be anti-Parkinson. Again, levodopa, why combined with carbidopa? It's important. Peripheral carboxylase inhibitor, okay. And levodopa is not used in drug induced Parkinsonism. Also levodopa when used with hypertensive drugs may cause postural hypotension, okay. Now anti-anxiety drugs, so barbiturate versus the benzodiazepine. So what are the drugs which are used, benzodiazepine drugs which are used for insomnia? It's important. So it can be asked directly in the Viva. Now sedatives and hypnotics, okay, can be asked to differentiate between both of them, right. Now a new class of drugs, jet drugs, can be used as a short note. So these are sleep drugs, okay, very less side effects. Now hypertension is a very specific common question for cardiovascular system. Here you should know about diuretics versus antidiuretics and A, B, C, D. D for diuretics, C for calcium channel blocker, B for beta blocker, A for ACE inhibitor and ARB, right. So ACE inhibitor versus ARB, should know the side effects and all, okay. Association with bradykinin, you should learn about it. Now the sartans, the ARBs, there is telmisartan, olmesartan, losartan and valsartan. So in the valsartan you may be asked about ARNI. In the losartan about uric acid and gout. So again gout is important. In olmesartan again for the heart, okay. And telmisartan associated with diabetes plus hypertension is a drug of choice, okay. So ये पढ़ लिए. In opioids, again use the indications and contraindication of opioids in different ways. We can use morphine. So it may be asked as a long question, very important. Again, this is Viva, so just ask about common morphine side effects and all, okay. Now misuse and abuse of opioids, okay. So one is use, one is misuse and abuse. The other part is addiction. And de-addiction. How can we the morphine withdrawal? Now cough, again dry versus wet cough. So in the dry cough there is antitussives. Antitussives can be of opioid and non-opioid origin, okay, and in the wet cough it is expectorant, okay. So there is a cough center in which antitussives suppress cough center, okay. Now asthma versus COPD. Again, asthma is reversible, COPD is irreversible. Name of the bronchodilators, okay, theophylline and all, everything you should know. Salbutamol, theophylline. From the IG one perspective, there is omalizumab, monoclonal antibodies, and some old drugs for asthma and some new drugs for asthma, okay, like roflumilast in the PDE4 inhibitor category, okay. There are other also like cilomilast, okay, and one drug is apremilast, which is used for psoriasis, okay. Now anticoagulants, oral versus parenteral, okay. So what is the role of MI of anticoagulants, ठीक है. रोल ऑफ अगेन यहाँ पे भी अगर इम्पोर्टेंट दिखा जाए तो मॉर्फिन, तो रोल ऑफ मॉर्फिन इन MI, ठीक है, याद रखना. मोना, दिस शुड बी रिटन राइट. नाउ नेक्स्ट, yes, heparin. तो लो मोलिकुलर वेट heparin, what is the use of heparin versus warfarin and when it is used. Another drug is fondaparinux, okay. Next, iron preparations. Iron preparation may be oral or parenteral. We have to know about the salts of iron. Salts of iron, very important. Okay. Now in anemia we use the iron preparation. Now where there is chronic kidney disease, we don't use iron preparation. We basically give the erythropoietin because it is not secreted in the kidney, it is not formed in the kidney. So basically erythropoietin is a classical injectable drug which can be asked in the Viva in detail. Okay. Heart failure, so there is acute and chronic. Heart failure, acute and chronic. So in heart failure, again, what is the role of beta blockers? So beta blocker is used in the heart failure with the reduced ejection fraction. Okay. Then role of beta agonist. What is the role of beta agonist here, right? So doses of dopamine, low dose dopamine, moderate dose, high dose, किस receptor को block करता है, like this may be asked in the Viva. Anti-malaria agents like chloroquine, primaquine, doxycycline, ठीक है, artemisins, ठीक है. So it may be asked in a short note. And very important question, what is the different drugs which is used in falciparum vivax and falciparum, okay, and also what are the drugs which may be used for the prophylaxis of malaria. Suppose a person who is coming from US is coming to India or Africa, what drug should be taken, right? So the answer is doxycycline, okay. You should know about these things. Also doxycycline is used in chloroquine resistant malaria. Antiviral drugs, again, HIV, herpes, hepatitis, COVID, these are important ones. Hepatitis C is important. All the drugs are important. Again, in the HIV, there are the antiretroviral drugs. Now, which are the drugs which is used both in HIV and hepatitis B? That is also one question, an MCQ. Okay, from NEET perspective. Now in HIV there are navids and gravids and all the retroviral drugs, these are important. Now in COVID, one drug was remdesivir. It was used in injectable, black marketing hota tha, you should know about the drug, okay. In the herpes also, like herpes simplex, what do you get and what the drugs can be given, it's important. For the anti-epileptics, again, it may be narrow spectrum anti-epileptics and broad spectrum anti-epileptics. Remember, broad spectrum anti-epileptics is one of the is valproate, levetiracetam and all. Narrow में आ जाएगा phenytoin and other drugs. There are many drugs, okay. So narrow and broad spectrum anti-epileptics are important. Which channels they are affecting, उसी से सोडियम है, बीटा ब्लॉकर है, पोटेशियम है, कैल्शियम है ना. रोल ऑफ मैग्नीशियम सल्फेट, important, right? Now mi drugs में again these are morphine, oxygen, nitrates and aspirin. These are important. मॉर्फिन का क्या रोल है, नाइट्रेट का क्या रोल है, ऑक्सीजन, एस्पिरिन और क्लोपिडोग्रेन. ओके, ऑल द डोजेस ऑफ एस्पिरिन. लो डोज एस्पिरिन को क्या कितना होता है, मॉडरेट, एंड हाई डोज ऑफ एस्पिरिन लाइक द डोपामिन. सो डोपामिन एंड एस्पिरिन का ऑल द डोजेस आर important. In these lipidemic drugs, there is a difference between statins and fenofibrate. So statins, why given at night time, and fenofibrate when it is used. Okay, so when statin is used, when it is used in the combination with fenofibrate. Okay, these are important. Again diuretics are very important. Why diuretics are contraindicated in pregnancy is important. Now, high ceiling versus low ceiling, what is the meaning of ceiling effect? Okay, and what is the indication of diuretic? Suppose one diuretic is used in mountain sickness. Okay, now another diuretic, suppose it's used in the pulmonary edema. Okay, so what is the name of the your diuretic? Okay, now again in the azole category, so all the azoles, there are antifungal, fluconazole, clotrimazole, right? There are again antiparasitics. Okay, so albendazole. So again, so everything ends with zole, but they are different class of drugs, so you should know all the drugs. Okay, these are important. Now, breathlessness, again breathlessness can be asthma because of respiratory origin, or it may be CVS origin. To how to differentiate between breathlessness of respiratory origin and CVS origin. So again, these are very important crude questions and important topics for Viva. So there are other videos for practical and Viva questions. I think you should go through it once. Okay, so all the best.